call it the 5 Bs: bloating, bitchiness, blemishes, bloating, and breast tenderness. Like, those are the things, like, that a lot of women feel when they have, like, excess estrogen, whether it's due to, like, giving hormones or not. That's my personal, like, way of doing things. You can optimize everything else and, avoid all of that other stuff.
Step right up, folks. You are now entering It's a Circus, where motherhood, womanhood, and self care aren't always a show stopping act, but they're certainly entertaining. I'm your host, Elsa, here to prove that no one really knows what they're doing, and that's perfectly fine. Let's have some real conversations, peel back the layers, and remind you that you're never alone in this season of becoming. Let's get the show rolling. Are you guys in for a treat? This episode is absolutely inspiring. It blew my mind. I learned so many things, and it's just wonderful on so many levels. Jessica Silver is a board-certified nurse practitioner and hormone specialist who built her practice after experiencing firsthand what so many of her patients describe: the feeling of being dismissed, misdiagnosed, and told everything was fine when it clearly wasn't. That experience became her foundation for Renewed You and her signature hormone optimization method. It's a 9-month clinical partnership program designed to help high-achieving women identify and address hormone dysfunction before it becomes a crisis. Certified in advanced bioidentical hormone replacement therapy, Jessica combines clinical precision with a deeply personal approach, helping women finally get the answers that match their experience and a plan that actually works. I'm so excited for you to be here and listen to all of this. Let's just dive right in. Here's Jessica. Welcome, Jess, to It's a Circus podcast.
Hello, hello.
Okay, I was just saying this offline, but I'm going to say it right here. I'm so excited that you're here.
Excited as well.
Oh my gosh. Okay. Well, we have a lot to dive into. I would love, though, to start us off with the question that I ask everybody is, who are you a mom of? How long have you been a mom for? And have you always wanted to be a mother?
Okay. So, yes, I have one little boy. He's 4.5. Um, and well, actually, I guess I can just say it now. I have one on the way.
So exciting.
um,
Congrats,
so
mama.
yeah, it's super exciting. I'm 12 weeks, just found out it's gonna be a little boy, so
Stop.
another little one coming. Um, but yeah, so been a mom for, 4.5 years. And have I always wanted to be a mom? Yeah, absolutely. I have. My mom had me when she was 19. So growing up, I was like, oh yeah, it's so cool to have a young mom. Like, I'm gonna be a young mom. Then I get to 19, 20, 25. And I'm like, no, 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 not for me, not ready. So yeah, I didn't have Caden until I said I wanted to have, that's funny. I said I wanted to have a child, at 30, before 30. I had him 2 days before my 31st birthday.
Oh my God, I love it. I love it.
It's like, yes, I made the goal.
Yes. I understand. I was the same. I was like, I want to. And by no means when I say this, is this a reality? Because lots of people have kiddos after 40, but I was literally like, I want to have them before 40, and literally gave birth at 38, gave birth at 39. I was like, and we're done and we did it and I did a thing. So like,
Yeah, you're
amen.
like, goal, check.
Seriously. And that does not happen in life. And I can't believe that I made that happen. But it was one of those things where I was like,
Yeah.
okay, done, done, and done. Oh my God. Okay. So congratulations. And like
Thank
fellow
you.
boy mom, how are you feeling about boy? How are you feeling?
Um,
Period. Tell me everything.
well, so we literally found out last night. Um, we're having a boy. Um, I'm excited. I mean, at the end of the day, we may get into it later, but it's been a struggle to get to this point. So, a healthy baby, boy, girl, doesn't matter. We're happy. I think the family was hoping for a girl. I mean, I think we were kind of hoping for a girl. There's so many boys in our family. So, um, but at the end of the day, it doesn't matter. Yeah, we're excited. Super
Oh
excited.
my gosh. I'm so excited for you. So when are you due then?
It'll be the end of June, so next
Mm.
summer.
Ah, okay. I'm very
Yeah.
excited. That
And
is super exciting.
yeah, it's been very, I don't know if it's been different or not, to be honest. 5 years ago, I do not remember
Wow.
when I was
Yeah.
pregnant. I do remember I loved being pregnant when I
Mhm,
had Caden. I felt good. I, like,
mhm,
was able to work out. Like, I did
mhm.
not have a bad pregnancy at all. Delivery was fine and everything. But yeah, the last, like, couple weeks, I've been, like, super nauseous and irritable. My husband's like it says the doctor, he's like, "Well, is there anything you can do about her attitude? Is there medication for that?" And I was like, "Oh, I'm sorry, I'm sorry."
You're like, "You have, quite a bit of more months left, buddy."
Yes.
Yeah.
I'm like, "It's just the first trimester, who knows?"
Oh my gosh. Okay. So congratulations. I'm so freaking pumped. And two, like, yes, it's wild, and you know all too well that like getting to the baby. I mean, you just are just so thankful that there is one and you can bring that into life. So, I mean, I totally hear you.
100%.
Yeah, that's how we felt too. We were like, okay, want a girl, obviously, because we had a boy. And
Yeah.
then, I mean, and I think we were talking about this too, maybe offline before, but like, I have a million girl names, a gajillion. I could have 10 girls and still have like more girl names I want to do. And it's like the two boy names that we ended up with were like, oh, it was so hard.
Drag them
Yes. Yes. Yes.
Yeah, I mean, it's funny because I think we came up with Caden's name, like, a month before he was born. Everyone's like, "What's his name?" I'm like, "I don't know." And we couldn't decide, and we were trying, like we would say things to each other and, like, it would just we didn't neither one of us didn't like it or something, and we actually ended up finding this app. I don't even remember the name of it now, but, it's like a Tinder app.
Oh, love that.
It's like, you each, like, sign up for it and you, like, swipe left or right. It, like, gives you names,
Oh my God, fun.
and yeah, you just swipe left or right, whether you like it or not, and it, like, tells you when you match, like, a name, and, like, so later that night, then we talk about it. So and I'm pretty sure that's where his name ended up coming from, but
That is hilarious and very modern and very like progressive. I wish like we had that because it is so hard to dive into those names like oh
well, we
man.
didn't have, like I mean, well, we do have, like, family names that run strong, but we weren't really wanting to do that for, like, a first name. Um, so yeah, we were just like, I have no idea. And that's probably exactly what's going to be for this poor child as well. I have no idea what his name's going to be.
Oh my God, I'm
We'll
so
see.
excited. Okay, so with Caden, your first, was this a planned pregnancy or was this a surprise?
Planned,
Okay.
planned. Um, my husband, oh gosh, he's 13 years older than me. So he's like, we need kids yesterday. And of course I was on my 30 timeline too.
Right.
So, um, yeah, we actually had gotten married in January 2020. And then we got pregnant like the next month,
Oh my
um,
gosh.
which, was good, but unfortunately, I ended up having like a missed miscarriage.
Okay.
So that was heartbreaking for both of us. We were super excited, got the positive pregnancy test, hadn't gone for like an ultrasound, they make you wait like
Right.
however long, especially with your first.
Yeah.
And so, we like bought a little onesie. We were so excited to like tell our parents and all that stuff. And we did. And then we went to like the 9-week ultrasound. And it's funny. Well, it's not funny, but I'm friends with my OB because I used to work labor and delivery. And so we worked really closely together. We got there and they, like, give us all this, like, baby packet stuff and, like, "Oh, congratulations, blah, blah, blah." We do the ultrasound after, um, and there's a baby, there's a heartbeat, but it's like it was a weird heartbeat. Like it wasn't consistent. It would like, it was like doot 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 doot. Like it was, and he was just like, you could see the look on his face. And he's like, "Oh no." You know, he's
Oh,
like,
man.
I'm really sorry, but he's like, I just don't think this is gonna be a viable pregnancy." And so of course we were totally crushed. Um, we had to wait a couple weeks to go back, get another ultrasound, and just to basically confirm that there was no heartbeat. And then ended up having a DNC.
Good.
So
How
yeah,
far
that
along were
was
you to have the DNC? Because that feels like a lot.
well, so he gave me an option, I
Okay.
think to like take the
Yep.
pill that they give you to like
Yeah.
induce it, but like I just I just wanted it to be over and I wanted to like try to have a baby, again
Right.
as soon as I could.
Right.
So, I opted for a DNC. I think I was like 11 weeks or something like
Yeah.
I don't remember.
Oh, man.
Yeah. Oh, and it was like the day of like the next day was my birthday and my husband was trying to be so sweet and like planned a surprise birthday dinner for me
Oh
and
my
it was
gosh.
awful,
Oh, no.
terrible and it was just yeah. But yeah, so that was our first like got pregnant right away,
Mhm.
which is great, that
Yeah.
we didn't have to, struggle for a long time. So we knew we could get pregnant. So I think we had to wait a couple months to try again and we did and we ended up getting pregnant,
Mhm.
with Caden that time, which ended up being a viable, great pregnancy,
You love being
thankfully.
pregnant. Yeah.
Yeah, yeah, like I said, I don't remember the early I mean, obviously, it wasn't that bad if I can't recall, like,
Right.
being extremely miserable, so I must have been okay.
Yeah.
But then, yeah, I remember just feeling. When I was pregnant. I mean, of course, the last couple weeks are always terrible, but, you know.
They are always
Oh,
terrible. I mean, you are just like it's so hard to describe this to people too if they haven't been there. It's just like your whole being is like, "Please get out of my body." And then, "Can I breathe? Can I walk? Can I eat? Can anything fit?
yeah.
Can I move?"
And just to top it all off, I got pregnant in well, I got pregnant in June of 2020. So,
Oh, man.
COVID times, the world was shut down. I was a nurse at the hospital, working full time, having to wear these N95 masks and like the whole getup. I remember one time I was at work. Thankfully, my coworkers were like really great and didn't make me like have a patient that has COVID.
Right.
Hallelujah. But I had a patient who needed an epidural and I was in there and like you're just gowned up in so many things and I was just sitting there and I looked at the of course the patient's like terrified and not happy either and I'm like I have to go. Like, I started, like, sweating and I thought I was gonna pass out, and I'm like, "I have to leave," and I just had to, like, rip everything off of me and, like, go sit down for a minute. It was awful, like, ugh, I remember that was, like, a terrible, terrible time, but yeah, yeah,
Were
working
you
during COVID. Well,
Oh my I mean, I can't imagine, and, like, clearly, I know that everybody celebrated the nurses, but, like, for real, like, on the front lines of the freaking earth shutting
right.
down.
I worked in labor and delivery, like, I was not working med surg, respiratory, ICU, like, none of these crazy places, but like, our patients had COVID and our patients were really, really sick. And at that point in time, the epidemic was so bad. Like our ICUs were totally full. We had an entire unit on our floor of like people who were waiting to be transferred to the ICU, needed a vent. Like, we're not trained to do vents. We're not trained to do these things. And oh my gosh, it was just such a scary time with like no resources and ugh. I mean, obviously everyone ended up being fine, but still terrible, terrible time.
Yeah, I mean, seriously, what a time. I mean, it's so hard, and it's so funny because as I'm doing these interviews, it's like everyone, there is this zeitgeist, and you hit that mark. It's like their kids are 5, their kids are turning 5. Their kids are like it's like everyone I talk to has their like delivery
Ex-
story during yes, exactly, like this motherhood. I see this meme that's like circulating on Instagram, and I've reposted it a couple times, and it's literally like, hey, if you have had a kid like in these like time frame, it's like like you are different. Like your experience is different. The PTSD from it all is different. Like everything
Absolutely.
during that
Yeah.
time is like wild.
I mean, it was our first child, and my husband couldn't come to any of our doctor's appointments, nothing. Like, it was awful. And it's like, of course, especially because we had had a miscarriage, I'm like, I didn't wanna go to this first ultrasound by myself, like, but
Oh, of
we
course.
had no choice. Um, and then, well, working in it just was terrible too, but I think what it was, like, literally, like, the week before I delivered, I think that, like, the hospital finally lifted its, like, no visitor policy.
Wow.
I was kind of bummed about it. Um, because I was hoping it would just be, like, me and my husband, and that was it, but, yeah, it had, like, literally just lifted, so, like, March of the next year, but yeah, it was just crazy, crazy times.
Okay, so as a labor and delivery nurse, you like know what happens, right?
Yeah.
Okay, so talk to me about that because I am like super scared of all the things. Like even being in a hospital is like so terrifying. It's not my strength. The body stuff, it's just like tell me the bare minimum. I don't want to know details. Like kind of that's my vibe. And I was uh disaster around like figuring out what I need to do at birth. So tell me as somebody who's in the know, who's in rooms, like how that was and then actually going through it.
So, you know, people ask me, all the time, like, how was labor? Like, were you scared? Were you,
Yes.
and, fortunately, I think, like, I had like a totally different perspective going into this because, like, I wasn't, like, I knew what to expect. I knew all the people around me who were going to help me deliver my baby. And, like, I didn't have the unknown of, like, well, what does this mean? What does that mean? And what, like, so I mean, I was very calm. And my husband's probably like, "What is this? You're so weird." He was more scared than I was. Um, and like I said, my delivery went like perfectly smooth too, so it wasn't super crazy. But yeah, like being a labor and delivery nurse. Well, for one, when I decided I wanted to go to nursing, I was like, I'm not doing anything other than this.
Really?
um, yeah, because I don't know, I didn't really wanna be a nurse.
Yeah.
I just knew that I loved medicine and I wanted to, like, be in the field, and I was a medical assistant for a really long time, and I was like, "This is just not enough, like, I
Mhm.
need to do more and make more money and,
Mhm.
do whatever." So I went to nursing school because that just seemed what you were supposed to do.
Right.
But I was like, "Okay, if I don't get a job in labor and delivery, I'm just not gonna have a job."
Yeah.
So got really lucky and got the job, and it was a really it was really cool because when I was pregnant, like, all of my friends were pregnant and having babies, so, like, I got the privilege to, like,
Wow.
deliver, like, a lot of my girlfriends and their babies and, like, be there for them, and I don't know, it was just, like, such a special, like, time and moment, I don't know. Like, I'm sad that I'm not there anymore. I miss it sometimes. I don't miss, like, working holidays and weekends and
Oh,
stuff like that,
yeah.
but I do miss, like, just the process of labor and delivery and being able to help moms just, like, kind of bring babies into the world and, like, hoping to, like, ease their mind, as they're going through it because it's scary. Like, I can't imagine, like, not working there and coming, like, who goes to the hospital, before the age of, like, 50 for anything?
Exactly.
You go there and they're like, "Oh, you have no idea how this is supposed to go," or,
Yeah.
like, if that little noise on the monitor is normal or, it's scary. I mean, I can't imagine.
Yeah, it is, it's so funny. So, And I hope that you feel this. I feel like everyone that, is birthing in a hospital and has the support of nurses, everyone is like so thankful. So like overly just like, oh my gosh, like the best nurse, the best care, like everybody, like you guys are doing the most in there. The doctor just comes in and like holds the baby and then you're like, okay.
Yes.
You're like, I know
That's
that very
exactly.
well.
Yes, that's literally how it always goes, unfortunately. Sometimes the doctor doesn't even make it,
Right.
and we get to deliver the babies, not on purpose, but, you know, you just can't help it, but, yeah, it's just I don't know. I it's just such a special time in, like, someone's life, you know? Um, but just as, like, happy and amazing it is, there is also, like, really terrible things that happen there too that, it's not the best job, but it just gives you a whole nother perspective on, like, the struggles that a lot of people have that just aren't even you don't even think about. You go and, you get pregnant and you're like, this is gonna be great. Everything's gonna be fine. And, I don't know. I just feel like I saw a lot of bad too. So
Sure. Yeah.
it's always nerve-wracking.
Right. Oh my gosh. So crazy. Okay. So your birth was good. And then how was postpartum? Did you get to have time off? And what was that experience like for you?
Legitimately life-changing forever.
Yeah.
Um, so like I said, I had a pretty easy delivery. Like my water, I was like 39 in like 4 days or something. My water broke at 6 o'clock in the morning, went to the hospital, um, had him by 2:30 in the afternoon.
Oh my
Like
God.
it was insane. Like I figured I was gonna be there for days and days on end, first baby, blah, blah, blah.
Right.
Came pretty quickly. So I mean, not mad about it. I'm glad that it did and it was easy and no complications. But yeah, and of course, me being me, I'm like, I know what I'm doing. Like, I don't need to stay here. Let's go home. Trying to like get out of there so fast.
Yeah.
um, and we did. We got home within like, 36 hours or something like that. But we got home. Everything was good. Kaden was a good baby, especially the first like, couple weeks or whatever, normal baby stuff. Um, I and I don't even know like where to start with this. So I had really, really bad postpartum anxiety. Like, I don't think I necessarily realized it when I was going through it.
Yeah.
Um, but I mean, I have anxiety anyways, or before,
Right.
but it just got so much worse and I didn't realize. And it was like anxiety of like, not that like something was wrong, but like I wasn't doing enough or like I needed to be doing things that like just weren't they just didn't in my head it made sense, but really in reality it really didn't, like obsessing over like whether he's eating, obsessing over, like I was like, "Oh, I'm not getting enough breast milk and like pumping all the time when I shouldn't have been doing any of that." Like I ended up getting so engorged and breastfeeding was a disaster for me to be honest. Um I produced so much, and Caden ended up well, we didn't figure this out until he was 2 years old, but, he ended up having, like, cheek ties.
Oh.
Um, Never in my life have I even heard of those,
Yeah.
like a tongue tie, a lip tie,
Right.
like all those things. We've heard of those and see them all the time, but no, he had cheek ties, so, like, his upper cheeks were, like, connected at, like, the bottom of his thing, so, like, he couldn't he wasn't talking at 2, and we're like, "What is going on? Like, why?" He's not even, like, saying any words, which was weird because every other milestone was fine, so anyways, we ended up, finding out he had cheek ties, which is probably why I had such a hard time breastfeeding too,
Yeah.
um, but, yeah, so I had the anxiety really bad, I definitely, um, had to get on, like, medication. I tried a couple different ones. I don't think anything really ever helped. Um, but to add to all of that, I actually ended up probably, like, 2 weeks, 3 weeks after I had him, I started getting fevers.
No.
And of course, I was super engorged,
Right.
like my breasts and all this stuff. So I'd go to my OB, time and time again. And I'm like, I have a fever. Like, I must. He's like, oh, you have mastitis. Here's an antibiotic. And I'm
Right.
like, okay. It would go away. Then it would come back like the next week. And I'm like, oh my God, it's happening again. Like, what is going on? Give me another antibiotic, a different one. And then it'd go away. And then a couple weeks later, it'd just come right back. And I'm like, what is going on? Like, he did like a breast ultrasound, he did like all the things that he could think of. And like, no, I didn't have an abscess. I wasn't like, it wasn't mastitis. He's like, I don't know. Like, I don't know why you keep having these fevers. And like, when I say I'm having a fever, it's like 104. Like,
Gosh.
it was like insane. Um, and so, yeah, those fevers started, right after I had him. And I literally have had them, well, for the last 4.5 years.
No way.
Um, I I think it wasn't until had him in March. I think it was in December when I started getting all this, like, crazy testing done. I was desperate. Like, these fevers were, like, debilitating.
Mhm.
Um, I was extremely exhausted. I was, like, having muscle aches and, like, night sweats, and it was just awful, and then just being postpartum in general and having a
Right.
newborn,
Right.
all of these things, it was just really stressful, and, like, I was just over it, and I'm like, "I somebody needs to help me." Like, my primary care, she did a bunch of blood work and nothing,
Right.
nothing came back,
Right.
and so my, um I worked at the hospital at that time, Sarasota Memorial Hospital. I remember I was, like, up one night just, like, Googling random things and, like, symptoms or, whatever, trying to figure this out. Um, and I ended up, like, Facebook messaging the head of infectious disease at Sarasota Memorial Hospital. I did not know him whatsoever. But, it was COVID times and, like, I knew who he was because he was the head and, you see his name all over the place, and I'm like, "Well, something's going on with me. I don't know what it is." And I was like, "Let me just throw this out there and see what happens." And I wrote him this, like, long thing about my situation and blah, 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 and surprisingly, like, he responded
My God.
and, kinda took me under his wing and, you know, heard my story, ran all these tests, did all these things. He unfortunately, he got to the point, 5 or 6 months later that he couldn't like figure it out either.
Mhm.
Um but he's been like even to this day, like we still keep in contact and he still like keeps in touch with me about things. I mean, I have had every test ran under the sun. I went to the Mayo Clinic. Um to have them try to, like, maybe do something like a bone marrow I had a bone marrow biopsy, a PET scan, you know, whatever you can think of, I've had. The only, like, weird thing that ever, like, came back with anything was a lumbar puncture, that just said I had, like, a lot of white blood cells, but, like, that's very nonspecific. It just means there's, like, a lot of inflammation. I'm like, "Okay, great." Like, where's it coming from?
Right.
Like, why
How
is
do we fix this?
Yeah, and, like, I think all of that happening to me
Mhm.
started this journey for me of, you know, functional medicine and, like, root cause, and so, when I had Caden or when I was pregnant with Caden, I was in school to become an NP.
Okay.
Um, I had taken some time off, probably I took, like, 3 months off, like, after I had him and kind of reevaluated everything, but I still wanted to do it and finish it, but, I during that time, I think I just lost so much faith in traditional medicine because, I I understand medicine, like,
Right.
I'm in it all the time, I'm going to, like, the best of the best specialists, I went to neurologists, endocrinologists,
Right.
infectious disease, anyone you could think of, and, like, nobody had any answers. So I went to the Mayo Clinic in Rochester, Minnesota, for
Right.
God's sake.
Right.
They still had nothing for me.
Wow.
And I'm like, "What?" Like, this is crazy. Like, there's no way that, like, I'm the only person in the world that is having this issue, and we can't figure out why. And so I
Yeah.
was like, "I figure this out on my own, I guess." And then, yeah, so I just started taking, like, a bunch of classes in functional medicine, and I just did a bunch of, like, stool testing, like, urine hormone testing, um, you know, I would get so far, but, like, anything I even tried, diets, lifestyle changes, anything like that, it didn't really help, and, like, I became a crazy person with tracking, like,
Oh, I bet.
tracking tracking my fevers, tracking my, whatever, um, yeah, and long story short, it ended up being hormonal, like,
No way.
I would get fevers when sorry, I would get fevers when I ovulated and when I got pregnant or when I, had my period. Sorry.
Whoa. So you realize that these crazy fevers, which how bizarre is that, is hormonal. And so, one, how do you find that out? And then what does that mean for you?
So, I find that out because, like I said, I was being crazy tracking everything. I didn't get my period for, like, God, I don't know, like, 9 months after I had Caden, which was weird too because, like, I had stopped breastfeeding after, like, 3 months, but I think my body was just, like, so stressed
Right.
with with the fevers and the anxiety and all that stuff. But, yeah, so, I mean, I basically, a lot of these doctors were like, it's autoimmune," and you can't really explain autoimmune, and I'm like,
Right.
"Okay, well," I wanted so bad to, like, get back to normal because I wanted to have more kids. I wanted to, like, get pregnant again. I wanted to, like, have more babies and, like, well, feel better, of course, but, like,
Mm.
um, so my goal at that point in time in the beginning was, like, I just need to be able to get pregnant, like, so I had tried, high dose steroids for a really long time to try to, like, make the fevers go away.
Yep.
They worked for, like, a little bit, and then I got to, like, 20 milligrams of prednisone, and they just came back, and I'm like, "Ugh, well," and
Wow.
for I can't be on prednisone my whole I just can't be on prednisone my whole life, and then I saw a rheumatologist, and she's like, "Oh, yeah, it's autoimmune, let's just, like, try this medication." So I was on Plaquenil, like, the hydroxychloroquine, like the, anti-malarial drug for
Right.
I was so
Ah,
desperate to, like, try anything to make these go away. Did that for a while, nothing happened. She's like, "Okay, well, let's add another drug," you know? And I was like, "Okay."
yeah.
And
Anything to make this work.
yeah, and so I did it, and 'cause they were like, "You can't get pregnant when you're having fevers like this, like, you just can't do it." And I'm like, "Okay, well, then make them go away."
Right.
Like, so I was desperate to do anything, and, she gave me this other drug, Emuron, which is another immunosuppressive drug, and it did nothing except for, like, kill my liver enzymes, so I'm like, "You know what? Like, this is dumb. All of this is so stupid, like, it's not working, and, I just need to figure something else out." And so I kinda just, like, gave up on, like, trying for a really long time and was just hoping it would go away and tracking everything in case, something else came up. Um, but yeah, it was just really, really miserable, and I ended up, actually starting a business based on, like, functional medicine and all this stuff too, but I was having such a hard time starting that business, I think because I had so much doubt in myself because I'm like, I can't even figure out what's going on with me. Like, how am I going to help other people? And like, I had like spent so much money like doing this, trying to start this business and do this thing. And clearly I wasn't like extremely passionate about this. I just was desperate to like help myself.
Right.
Um, and so I I don't know. I'd finished my NP program and um I found um what did I say? I had found this like hormone thing because I'm like, this is hormonal. I
Mhm.
don't know like what about it is hormonal. And I'm like, I think I understand my hormones, but maybe I don't. So I decided to like, go do this hormone course, which has been like life changing for me. Um, And yeah, I mean, do I still have fevers? Well, surprisingly, I haven't had a single fever since I got pregnant this time, which is wild. Um, but yeah, so I don't know what's going to happen after this baby comes out, if it's going to happen again or.
God, okay. I have so many things to unpack. First off, I am dying for you to talk about your business. And it's so cool, Jess, to hear like the arc of your story because I also was like wondering how you got into all of that. So you finish your MP, you know from your own personal journey that like it's hormone based. And then so tell me about the business. Tell me about your business.
Yeah, so Renewed You.
Mhm.
It's a virtual hormone business that I have. Um, you know, it's definitely a personal journey that got me like here, but like I think I saw obviously I had my own stuff and I saw the lack of well, I don't know if it's knowledge or just caring or education or what it is in like conventional medicine.
Yeah.
And, I worked there for a long time and, like, I saw patients, like, struggling with the same things, whether it I mean, obviously not having fevers like myself, but, like, struggling with, you know, menopause, perimenopause, or, just trying to get pregnant or any of these things that are 100% hormone related. They just get kind of pushed to the side or ignored or, just not taken seriously, and I had been literally not taken seriously for years with these fevers and stuff, and I just was so sick of it. And yeah, so I found this like great hormone like course certification thing and I literally like fell in love. It's completely evidence-based, and it's non-conventional, they kinda go out of the realm of, like, what's normal and how, you treat people not only based on their symptoms, but how to, like, improve their health outcomes overall, that just conventional medicine doesn't really look at or really even care about, and it's so frustrating because even with my own journey, like like I told you, I suffered from postpartum anxiety so bad, I think I ended up like taking Prozac and like it making me, stable or like not suffering as much as I was. And I found this space of hormones and, how to utilize it to like help with mental health disorders.
Right.
And, I start taking thyroid medication. I get myself off of all the Prozac, all the
Wow.
things, and like I feel a million times better. I mean, do I
Right.
still have fevers? Yes, I was still having fevers. It didn't problem at all. But, like I'm like, why aren't we like utilizing these, bioidentical hormones, like the things our bodies are already making
Mhm.
to help us instead of, giving you, Zoloft or, Prozac or Lexapro or Xanax or, statins or whatever health issue you have. Like, why are we using these prescription medications? Like, they don't work and they're not like fixing the issue themselves. And I feel like there's so many people out there, not just me, that struggle with just doctors not listening or taking them seriously, especially women.
Especially
100%.
women, and especially, like, when our hormones are insane because, I mean, you know way more than I do, but, like, after you have your kiddo, 1, as you're pregnant, your hormones are wild, but then after you have your kiddo, it's like that crash, right? And then potentially trying to rebalance and however long that takes. Um, I mean, it is really wild that there's no support from, like, that
Yeah,
process
there
your
really
body's
isn't
doing.
it. Like, this is what happens, and this is just you have to deal with it, and that's kind of what us women have been told about everything forever, like, especially, with menopause over the last 30 years,
Oh my
well,
god.
this is just life and this is what happens, good luck, nothing to help, and the that's the other thing that I'm kind of excited about with this pregnancy and, like, just where I'm at in my life and, like, my, business and whatnot is, I have so many more tools under my belt to help support me postpartum. Whereas, like, last time I was, just kinda thrown to the wolves of, like, "Good luck," like, "Go
Mhm.
home, take care of this baby, and just hope for the best." But, like, there are, your hormones completely go crazy and drop off, and, you're breastfeeding this child and you're super stressed, you're not sleeping, like, your body is missing so many vital hormones that, like, can help during those times. So yeah, I mean, I'm kind of looking forward to to kinda, helping myself through that transition and hoping, it'll just be a little bit of a different experience.
Wow. Okay, so I'm dying because one, have talked to so many people and have had, like, what, over 60 interviews at this point, and so many people talk about, like, that postpartum period, and I think what is told to us over and over again, and either by society or, like, by expectations of family or just honestly not knowing what's in front of you is that that time is you just got to manage through. Sometimes you're lucky and you may have, like, baby blues. Maybe you're, something else and you have, like, deep dark depression. I mean, it's all just right there. And then one, we're supposed to self-diagnose, which is very difficult when you're in that moment yourself and you are sleep deprived. You have all of these, like, different stress factors that are impacting all of that in addition. What specifically are you going to do differently this time?
Yeah. So, you know, I I worked in primary care. To go off a little off topic here just to
Yeah.
kind of make my point, I worked in primary care, as one of my first jobs graduating in P school, and, this is where I saw a lot of this, like, just women that are just miserable, whether it's, a 50-year-old or, a 28-year-old who just had a baby, like, she came to me one day, and she had just gotten, like she had checked herself into Bayside, like, the I think it has a new name now, but at Sarasota Memorial, they have, like, a behavioral, like, place that you can just, like, go if you're, like, in crisis, and she had, like, a I don't know, like, a 4-month-old or something, and she was just, like, literally could not handle, like, life, and she didn't wanna be around her baby and, like, all these crazy things, and I'm like, "Oh my god," like, I never experienced that myself, but, like, I cannot imagine how you feel, and I was doing anything and everything I could possibly do to try to help her, and at that point in time, like, I didn't have this training, I didn't have this knowledge, Of course, giving her the meds that, we're
Sure.
trained to do and give,
Right.
but, like, she also with her job, they she was having to go back and they wanted her to go back on the night shift and she's like, "I cannot do that." She's like, I'm already not sleeping. I'm not, it's she's like, "I just can't do that." And so, like, she basically, like, helped asked me to help her, like, write a note or, like, do whatever I needed to do to, like,
Sure.
help her not go night shift, but,
Mhm.
like, I just the worry and, like, we would sit there and cry together every time she'd come in because she was just so miserable, and I just felt so hopeless, and, I hated that feeling. Like, I hated that feeling. And I know she's not the only one that, deals with this. Labor and delivery, I see you at
Sure.
your happiest, well, usually your happiest moment, and then you leave. Like, and I have no
Right.
idea what happens when your baby after that happens. And like, I saw it, and I'm like, we are failing these women so bad. And like, so, now being pregnant and, going through this, well, first of all, I, before this pregnancy, like I had had a chemical pregnancy prior, like a couple months ago. Um, and then I also had an ectopic before, and like
Oh no,
why
Jess.
I don't know why like any of that stuff happened. I don't know if it's like hormone issues or what, but I basically just started treating myself.
Yeah.
I started giving myself thyroid. Like I said, it helped so much with the anxiety was the biggest thing for me. And I have really bad like ADD, OCD, and like
Mhm.
I would take all the time and like just need
Mhm.
something to help me focus. And like I haven't needed any of that since taking the thyroid medication. Like it's absolutely insane. And so like for one, this time I feel like with this pregnancy, thyroid medication is helping me a lot. Um, it is something that I didn't have last time, that I'm, having to adjust now. But I think postpartum, it's going to help a lot with maybe some of that anxiety, but also progesterone.
Mm.
Progesterone is super safe. So is thyroid, of course, for breastfeeding, anything. Um, and I have this. Well, what I've been taught and I've used on a couple patients who have had like such great success with it is basically like a super high dose progesterone like protocol. Like you can start it like before you're going to deliver, or you can start it right after you deliver. And like it just helps calm the anxiety and like try to keep you from like that dark place. That especially if you experienced it before, I'm
Right,
sure
right.
people are terrified to go back there,
Mm.
and there's just not a whole lot you can do about it, but, like, I've seen it, like, and it's crazy. Whereas you go to your doctor and they're like, "I'm sorry, here's, like,
Right.
a therapist number and a medication,
Right.
and good luck because it's gonna take, like, 3 months to work if it even works for you. We might have to try another medication," and like, I don't know, moms just don't, new moms don't deserve that. And we should enjoy this. Like my first, I don't know, year and a half, 2 years, like I feel like I don't even remember
I know.
like the first couple years of his life just because of like how stressed and like
Yeah.
anxious and miserable I was. So I don't know, but I have somewhat of a plan. We'll see. See what happens.
My gosh. Well, I'm so one, we have to do a part 2 because now we must know how the plan goes. And we need to know all the details. But 2, I mean, I think that is a really, uh, powerful place, and I know you, do a lot with different clients, but, like, what a powerful and, like, very beneficial place to service people is, like, in that postpartum moment. Because I do think there's a lot of questions, and if you are a first-time mom, you're also very distracted of, like, obviously all your focus is on the baby, and so it's so hard to, I don't know, manage through that, and if there is, like, support or help, I mean, that's incredible that you can offer that.
Yeah. I mean, and it's like not very many people know that like that's a possibility. So I'm like, I don't know how to like articulate that, but I was really thinking about, kind of sharing this whole journey, on social media just to, I don't know, make more awareness, that there is things you can do and things that can help. And yeah, I don't know, just something because it's not. And when I say I do hormones with my clinic, like yes, I do hormones, but not when I feel like when most people think of hormones, they think of like, perimenopause, menopause, like night sweats, hot
Mhm,
flashes, like low
mhm.
energy, all that stuff. Like, yes, it is that, but also like it's infertility. It's, like all of these issues, heavy periods when you're like 12
Mm,
years old, all of these things, the acne, that all these things that like just aren't normal to have when you're, in your 20s or 30s or, sometimes even younger than that. And it's just like these doctors just miss it. And it's just so sad, and I'm sure we're both part of this generation of like, let's just give them all birth control and like
right.
basically put a band-aid on it until one day you decide that you want to have a baby. And then all of a sudden you're like, I can't have a baby. Why can't I have a baby? And it's like, because we didn't address these things 10 years ago when you were having these issues. The birth control doesn't fix it. It's
No.
crazy.
Yeah, okay. So, yes, you're totally right, and I think that there's this really big thing that you're saying that I'm just gonna, like, echo to the world, is that hormones can impact so many things, and especially as a woman, right? Because our hormones are cyclical and change, with our period and all that kind of stuff. So, yes, hormones huge and impact us so deeply on so many levels, is not just from like the perimenopause, menopause. For you, when you're thinking about just the possibilities of what hormones, can service and help with, the warning label for hormone replacement therapy has like recently been removed. Talk to me about that. And does that change anything that you do or whatnot?
So obviously that is huge. Um, it's not so it's been a huge topic in so many conversations of mine recently.
Okay.
Yes, it's really big. So the FDA recently removed the black box warning on vaginal estrogen,
Okay.
which it's a great move forward. But it's definitely not like the, all in one, like hormones are safe and now let's just all do them.
Right.
Um, so they removed the warning label that says, it doesn't cause blood clots, it doesn't cause cancer, it doesn't increase your risk for any of those things because it doesn't. And, the one study back in 2002, I think it was, the Women's Health Initiative. This is what kind of sparked all of this like anti hormone, hormones are bad, like they're going to, cause breast cancer, give you blood clots, all of these things came from. It was an extremely, extremely flawed study that had no clinical significance, meaning like the data that they were using, like it literally meant nothing. It's a terrible study. There's gold standard studies that you should use to base clinical decisions on, and that is not one of them. But, the media went frenzy and it just changed an entire
Mm.
generation of women, and they
Wow.
really I think the FDA commissioner had said like this is one of the biggest mistakes made in medicine was in to harming women essentially, like killing women and just not being able to protect them because of how much damage, losing their hormones and telling them it's bad is. And the worst part about it is like that one study, they weren't even using bioidentical hormones. Bioidentical are the same as your body makes. You know what I mean? You can't patent it. A pharmaceutical company can't patent it because it comes from your body. You just cannot patent those things, so they can't make money off of it. That study was they used what they call Premarin, which is a synthetic pharmaceutical estrogen that is made from horse urine. Yes. So it is nothing like what our body makes. And yeah, you introduce that to your body and who knows what's going to happen. It can cause blood clots, it can cause breast cancer, it can, make all those things happen, but like you can't just put a broad statement on hormone replacement therapy and not like specify those huge differences. So yeah, I'm I think that there's a lot that times are changing and I think people are becoming more aware of this, but we're nowhere near like where it needs to be. With them removing like the black box warning on estrogen recently, I mean, that's great, but these doctors aren't educated. Like they were never taught like, you know, about hormones. Like I never learned anything about hormones in my medical training whatsoever. I had to seek it out.
Right.
And also not all training is equal,
Right,
you
right,
know,
right, of course.
evidence-based. It's yeah, and so I think the biggest issue is lack of education. And, a lot of these doctors are, they're just set in their ways. I did my training, here I am. You want hormones? Go find somebody else. Or they'll give you hormones and they just have no idea what they're doing. And, sure you might feel better for a little bit, but then like who knows, you have all these extra side effects and issues and like it's not a one size fits all for everybody. Like every woman is totally different and needs, completely different things. So I don't know. I think we still have a long way to go, but
Well, that's what I was gonna ask you because, you get your blood work done and they say, like, here's a range. And the range is like massive. That's like what normal, not normal is.
yeah.
So for you, um, what do you determine normal per patient? And then what does that even mean for people?
So the reference ranges on a lab. Well, for one, they're different depending on which lab you go to.
Oh.
LabCorp, Quest, there's a bunch of no-name labs all over the place.
Mhm.
I see patients all the time and they give me their labs and I'm like, well, whether it's the they're different ranges as well as different like what they're looking at, like the decimal points of whatever it is. So you just have to be very mindful of that for one. But then you also have to be mindful of like these ranges have changed over time. Like what they are today is not what they were 30, 40 years ago. They were completely different and they change as the population changes. So, and they base it off of, the majority of the population. And I'm sorry, but like well, at least in the United States, like, we are not a healthy country.
Right.
So the average healthy American, like, yeah, it ranges. The range is huge because, some people are really healthy and some people are really sick, but, like, mm, there's no correlation to, like, health in those ranges, if that makes sense.
Mhm.
Um, some things I do utilize the ranges for because it makes sense, but when we're specifically talking about hormones, like, that's just a totally different it's totally different aspect because, you know, certain symptoms that someone may have, like, may not be reflected in your labs, but you're like, "I've been trained, I understand, like, these symptoms come from XYZ," and, like, "Yeah, I understand, like, your labs look normal, but, like, that is not normal, like, that symptom isn't normal." And, there's things you can do, and half the time, you know, I I treat people based, with because of symptoms they're having, but, like, I think the bigger thing that I try to look at more than even that is, long-term health risks and, like, preventing health, you know, preventing health issues like chronic disease. Now, if you want to do that with hormones, like, you will be outside of those reference ranges.
Wow.
Like, if I'm treating you and you want to be, quote unquote optimal for like, bodily function and trying to prevent those chronic diseases, like you're not going to be in those reference ranges. You are going to be outside of them because that is what, you know, should be normal
Wow.
or, was normal for you when you were like 20 years old.
Right,
We don't
right.
we don't regularly do blood work on, 15 to 20-year-olds, but like if we did, like a thyroid number specifically,
Yeah.
free T3. Like most people, I look at their free T3 and it's like, say the reference range is from like 2 to like 4 or something like that, like on the lab slip. Most people I check are like 3 or below, But like if you were to check the lab of like a 15 to 20-year-old, their numbers are like 5 to 7. Like it's crazy. And those are supposed to be the best years of our lives. So like,
Right.
why can't we just get back to that?
Yeah.
Like at
Okay.
least
Okay, so that is really exciting. So, like, if okay, so help me, but, like, if you're not feeling like yourself, not, you know if you're feeling the brain fog or I don't know, if you're cramping, if your period's weird, if, like, whatever, when should people come and see you?
goodness, I wish people would come see me. I I think the hard part about that is, like, everyone thinks it's normal, like, if I ask somebody, like, "Hey, are your periods regular?" or "Are your periods heavy?" They're like, "Yeah. Yeah, they're regular. They're not heavy. They're fine. They're normal for me." And I ask, I have to really dig to, like, get people to say, I'm like, "Okay, are they a regular 28 to 32 day cycle?" "Well, sometimes they're like 23 days, but that's regular for me." And I'm
Mhm,
like,
mhm,
not really regular." Or I'm
mhm.
like, they're like, "Oh no, it's not, they're not heavy." And I'm like, "Okay, well, like, let's say how many, tampons are you going through in like your heaviest day?" And they'll be like, "Oh, I'm changing it like every hour." And I'm
Gee.
like, "Are these like regular tampons?" Like,
Yeah.
they're like, "No, they're like super plus." And I'm like, that's not normal. Like,
Right.
but they've been told their whole life that it's normal. So, you know, um, I wish all those people would come see me. Like,
Right.
but if you don't know it's not normal, how do you do that?
I know.
I think everyone, like, I don't even know what age would I say? I don't know. 18, maybe
Yeah.
even before that. Like,
Right.
get your blood work checked, your hormones checked, like, get a baseline when you're young and, like, check it every year. I mean, after you're, like, 30 or, whatever, you probably need to get it every 6 months, especially if you're just feeling off.
Right.
But, yeah, I mean, it's so hard to say.
It's so hard to say. So, I went to my OB and I was like, "Hey, like, I" 1, had kiddos at 38, 39. I think I literally had them right at, like, perimenopause, whatever, and back to back, right? So, I was pregnant with my second when my first was 5 months. So, psychotic stuff going on with my body. Yeah. And so, fast forward a year postpartum after the last one, I go into the OB and I'm like, "Hey, like, my first one, yes, I know, 5 months is not very long, but, like, I still was, like, kind of coming back to myself, like, the additional weight gain was, like, easily coming off, like, it was not a big deal. This second time around, like, very different, and I'm, like, feeling kinda weird, like, is there anything? She, who was probably my age, if not younger, was like, "Well, you know what it is 80% diet and 20% physical activity. So you got this, right?" And I was just like, "Okay, I need to go talk to somebody else." And then slowly and like, thank goodness, kind of falling into the right situations, really dialed in on this hormone piece. And, it took like maybe I mean, dude, a ton of blood work, maybe like 6 to 8 months, and land on something that actually made me feel good. And when I spoke to the nurse, she had put me on like a low dose estradiol patch. And I come to see her like a month later and I was like, "Yeah, I think it's like kind of working." And she's like, "Not good enough. You should feel amazing. We're going to like go with a bigger dose for you." Like, this should not be you accepting that, like, mediocre feeling and, like, a little bit is working. It should be like, you should feel amazing. There's no reason why you shouldn't feel amazing.
100%.
100%. And it's like, who's having these like, 1, the OBGYN is clearly not having that combo with anybody. And then 2, like, thank God for the Instagram algorithm that's telling me I'm perimenopause, because who knew where I would find that word? And then secondly,
Oh,
it
it's true.
exactly. And then it's like, okay, never in my, like, wildest dreams would I feel like I need to be, like, seeing my blood work all the time to make sure, or even advocating for myself and being like, "Oh, do I need to, like, up the dose? Do I need to do this? Do I need to do that?" Like, in
Yeah,
no world did I think that that's what we were having to do at this point.
yeah. Well, you say advocate for yourself, and like that one hits me hard because you have to advocate for yourself in this like community of medicine that we have now because well for one, yeah, your OB, your primary, like they're no help. Are they going to help you if you have a cold or you need to have a baby or just like regular screenings? Yes, of course. They're great for that. And I'm grateful for that. We all need
Right,
those things too. But
right.
there's just such a lack of education when it comes even just blood work, just regular blood work, like, yeah, they're looking at the reference ranges, and if you're in those, like, it's fine, and it's like they're not even catching, like, the trends, they're not catching, like, some of these things, they don't they look at what's in front of them, and, like, that's just is what it is. And it's so hard to find somebody that understands or is good or it sounds like you got really lucky when someone was
Yeah,
so like me I yes like I said I want you to like be able to prevent like chronic health conditions. Like I think that's probably number one, but like you're gonna come most people are going to come to me because of the way they feel and like the symptoms that they're having. um and of course, like, you shouldn't be having those symptoms, and, like, I'm gonna treat you until you're not having those symptoms anymore. We're gonna figure out why, whether it's hormonally or, like, metabolically or, you
right.
know, vitamin deficiency or whatever it may be, like, we'll figure it out, but, like, yeah, it's not a one size fits all, you can't just, like, a lot of OBs a lot of OBs or primary cares that you can find that will give you, hormones. They're like, here's a patch, here's a progesterone, have a great day.
Right.
Everyone gets the same dose, everyone starts at the same place, and it just doesn't work. Like I personally don't even consider estrogen in anyone that is like still having periods. Like I just don't. I will utilize any other hormone as far as like testosterone, progesterone, and thyroid mainly, or DHEA sometimes too, but depends. Um, because I have seen so many women, you know, be given estrogen when especially in this perimenopause state, you're having these symptoms of whether it's like hot flashes, brain fog, night sweats, or whatever it may be. And yeah, it absolutely can be due to like just the lack of estrogen, but perimenopause, your estrogen is like a
All
roller
over the place.
coaster.
Right,
It's
yeah,
crazy. You have no idea. One day your estrogen level, if you were to check it in blood work, it'll be like, you know, 56, and the next day in perimenopause it could be like 300.
right,
And it's like if you add extra estrogen to that 300 day, like you are probably going to be an emotional mess.
right.
I call it the 5 Bs. Bloating, bitchiness, blemishes, bloating, and oh gosh, what's the last one? Um Can't even think of breast tenderness. Like those are the things like that a lot of women feel when they have like excess estrogen, whether it's due to like giving hormones or not. But like,
Mhm.
yeah. So yeah, it's just that's my personal like way of doing things. But you can optimize everything else and avoid all of that other stuff.
I love it, and I think that is, like, so cool to know and even just to think about because When you're talking about for you, I mean, having your personal experience, your knowledge, and then being able to help these patients like go through and like feel better, I think it's like important to understand people's point of view. Because you're right. It's just like, hey, here's like the standard assignment. Well, and help me with this because I'd love to get your take on this is everybody's like, okay, for a woman, she needs to focus on estrogen, although we do also produce testosterone. And so you have a lot of people that are very hesitant to give testosterone to women as well. What's like your take on that?
Well, women make testosterone too, and
Right.
women need testosterone too.
Right.
You know, it is that it is that hormone that, well, it just benefits everybody. Of course, no,
Mhm.
women do not need anywhere
Mhm.
near the amount of testosterone as a man does, but especially in this perimenopause state, like your estrogen's going everywhere, your progesterone's going everywhere, like, you can't think, you can't, you can't get your mind straight, and you literally can't, like, keep your eyes open half the time, you're just drinking coffee all day long, and you're just like, "I cannot stay awake, I cannot." Like, my energy is just gone, and, like, that is where testosterone in women, like, just kills it, especially if, I work with a lot of women who exercise a lot too, um, and they're just like, I don't know why, but, like, I'm just not seeing the results in the gym, or, like, I'm all of a sudden gaining weight where I'm not doing anything different, or I'm not, like, able to build muscle like I used to or something like that, and it's like, well, yeah, like, testosterone is probably one of the first things in most women that, like, disappear, and you can give it safely at low doses to, like, help with all these perimenopausal symptoms, like, that most people experience, um, and it's safe. No, it's not approved by the FDA for women, which is crazy. So in most things, if they're not approved by the FDA, your regular doctor just is not gonna usually bat an eye at it, and they're just gonna be like, "Sorry, like, good luck, get it from somebody else."
Right.
Um, but there are so many studies out there that literally it's so beneficial, and one of the things that just, like, blows my mind to this day is that, there is a doctor, so there's a bunch of hoopla about hormones and breast cancer and all this stuff, but there is a doctor in, Ohio, I think her name is Rebecca Glasser. She is literally treating active breast cancer with testosterone pellets,
Holy
and
cow.
it's working.
Whoa.
Like, it is insane. Like, that's the thing that I feel like I wish more people knew. Like, testosterone therapy, or, well, just hormone replacement therapy in general, is protective. Like, it's not harmful. It's
Mhm.
not harmful like we think it is.
Mhm.
Well, you can't necessarily overdose on hormones either. Like, yeah, you can have some really bad side effects if you have bad doses, or, take too much or whatever, but, like, you can't overdose on it. It's not gonna kill you, and, like, half the time, like, your body is missing it, and that is why it's declining, So let's come back to this happy medium and, like, get ourselves back, you know, in in connection with itself. Back to, like, homeostasis.
Oh my god. Okay, I love that hot take, and I think it's really interesting, um, that that's a possibility. I love it. Okay, I have another random question for you. What about peptides? How do those, like, go with hormones? Is it a totally different thing? What's, like, your thought on those? Because you prescribe
So
that too.
yes, yes, I love
Mhm.
peptides as well. So peptides are such a great tool to use for many, many purposes. I mean, it kinda just there's like a peptide for everything.
Yeah.
But it kinda depends on your goals, but, like, some of these symptoms that people are having, especially if they're younger and, like, or they're, like, hesitant to start hormones, or anything like that. I think hormones and peptides, like, together can be, like, life-changing, absolutely. But, some people are like, I don't really wanna go straight to hormones. Like, I would rather try to do something else. Peptides are, like, essentially natural things that you can, like, put in your body to like help your body be better on its own.
Mhm.
Whether it's, fighting insulin resistance or like building muscle or, helping your skin or anything like that. Like there's a peptide for it. And, you know, I I see a lot of benefit when people can optimize their hormones and then, add the peptides in there, whether it's, they want to build more muscle or even enhance weight loss, or like a lot of people who suffer with like insulin resistance or PCOS, like they have such a hard time, losing weight, or like no matter what they do, their diet, their exercising, like nothing is changing. And these peptides can kind of just like give you a little bit of a boost to like help with that. Um, GLP-1s, the tirzepatide, semaglutide, those are peptides.
Right.
Those are really popular peptides, of course. But yeah, there's a bunch of other ones like, growth hormone aggregates that can help, your body produce its own growth hormone. So a lot of times, like, I'll have like younger men or even some women that come to me like, I don't really want to do testosterone, but I want like the benefits of testosterone,
Mhm.
or I want to sleep better or something like that. And, those types of peptides are great for that, and a lot of people see really good results. Um, or, I have someone come to me and like their hormones are actually pretty good. And,
Right.
of course, I could probably always make them a little bit better, but not everyone's like, no, I don't know that I want to like make that commitment right now. Um, peptides are always like a great, alternative to try to get the results you want without, committing to like a hormone.
Yeah. Okay. So cool and so good to know. I have like literally I feel like that's another thing that's just like dominating my like life right now is just like all these like peptides.
Yeah.
And I think of course, because you're like, oh, I want to feel better. I want to look better. Here's like another option to try. But I have heard and tell me that peptides have actually been around for like a really long time.
God, they've been around forever. A lot of them have some, well, not a lot of them. Some of them are actually approved by the FDA
Wow.
for treating other, growth hormone deficiencies and a few other things. But yeah, like I feel like it's the secret medicine of, or the secret weapon of medicine that like the FDA just like won't look at. Like they're not doing studies because I don't know. It's not because well, probably because they can't patent it.
Right.
They
Right.
can't patent it and they can't make money off of it. So big pharma isn't going to like put a bunch of money into a study that they can't make money off of. But like I think this is literally like the missing link, I think, in, helping people and, curing disease. And oh, it's so crazy. Like there's peptides out there that like claim that, they can help prevent cancer. Like who wouldn't want that?
Right. Right.
It's
Oh my
insane.
gosh. Okay, I love it. It's like really amazing and very exciting. Okay, so then from like your renewed your biz, all the things that you're doing for you right now, going through, I don't know, pregnancy and then also like, I don't know, a big boy, like an almost kindergartner. Like, oh my gosh, like tell me where you're at. Like what like self-care stuff do you have in place? What are you like prioritizing? What are you thinking about as you go into postpartum now with like two kiddos?
Oh gosh, that's a pretty loaded question because well, for one, I've been feeling so terrible.
Yeah.
I like just started feeling good again and like have finally been trying to like focus on myself a little bit more and like eat better and try to get back into the gym and stuff like that. But like, you know, I I'm just nervous. I'm just nervous about it all. We're expecting a new baby. We're going to be moving. I mean, there's just a lot. And of course, all my health stuff, like I don't know what's going to happen with that. It's just kind of a bunch of unknown right now, but I have a great support system. My little guy, can't believe he's going into kindergarten. Oh, um, he's great. My husband's great, and like, I don't know, we have a lot of supportive family, so I don't know. I'm nervous, but excited and trying to focus on doing some more self care, but it's been really hard lately.
I know. It's like it's such a strange question to ask because you're like, "Wait a second, I what do you mean self-care? I've, like, got all these things to handle." But I think it's, like, so important even just to mention because, I mean, everything that you're doing, with your business and the hormones, that's all, like, self-care too.
Oh yeah. Well, you know, when I first graduated with my NP, I loved my job as a nurse. Like I mean, I love delivering babies. I
Mhm.
got my NP and like I went into this world of like medicine and like the demand of that job was like the worst, especially like having just had a baby. I'm in, I basically starting a new family and I have this new career of like literally I was taking work home. I was working longer hours and like it was so stressful and like I hated it. Like I hated it. I had two jobs. The first was a hospitalist and then I worked in primary care for a little while and it was just like an awful awful time. And throughout all that I had a child then. He was probably like 2 or something and I was like I need to focus on well, for one, my health was deteriorating very quickly because of how stressed I was and, working super late and like on call and it was just stupid. And, I just had a realization of like my health and my family are way more important than any of this stuff. And like once I kind of found my like passion for, hormones and whatever and like started this new business venture, like I can say, like, yes, I'm super busy, but, like, I am nowhere near as stressed and, hating my job, like I was before, and I'm able to, like, go to all of Caden's things, pick him up from school, take him to school and, like, do all the things that I want, and, like, that's, that's what's more important, and so keeping that kind of in focus throughout, this new pregnancy and moving and all these other life changes, but I think it'll be okay.
Oh my god, amazing. I love it. Um, okay, I wanna ask you this because it's lingering, and I don't know, I'll put this somewhere if it doesn't make sense or if it does make sense, so I'm sorry, come with me on this journey.
Oh,
But
it's fine.
okay, good. I want to touch again on postpartum because there are moments and opportunities that I have to talk about it, but I think especially for you, talking about the anxiety piece and, going on meds and, the like deep dark of it all. Ha- Take us back there because I'd like to understand from your point of view when you realized you needed support and how you did. So if anybody is either feeling that or needing to understand that, what does that look like? At least for you in your experience.
Oh gosh, in my experience, at first I didn't realize I think that I was struggling so bad. I've always just been such a like, you know, high anxious, like trying to do things, clean up the house and do all these things anyways that like I feel like I didn't think it was any different. Um I had struggled with anxiety years and years ago, like in my 20s that I had been medicated for. And then for, I don't even know, I got off of it. I don't know what I really did differently, but like I was okay. And it wasn't really until, after I had Caden that like those feelings just started coming back up, like I would just cry for no reason. And I remember there was a couple times that like I'd be at home with Caden alone and like I don't even think he was crying or, like, doing anything, but, like, I just had, like, a flood of emotion, like, overwhelm of
Right.
I don't even know what or why, like, my life was great, like, we had everything we needed and, like, I don't know, but, like, I literally had to, like, put him in a crib, like, or, somewhere safe and, like, walk out of the house, and, like, I had to call my mom and was like, "Mom, like, I don't know what's going on, but, like, I just need to, like, be away from my baby right now, and, like, I'm the only one here, I can't do that." I just don't know what to do. I'm gonna cry thinking about it because it was such a terrible feeling to feel that way about, like, your baby, you know? I
No.
had no idea why I felt like that either, and, like, that was when I knew, I'm like, "Oh my god, like, I am not okay, like, I need help."
Right.
I don't know why I'm feeling this way again, but I am, and that's when I, had started the go to my OB and try
Mhm.
to, like, start medication, and the first one was awful, maybe just nauseous all the time, and it takes forever, it takes, like, months
Mhm.
for those things to start working, and then, you start at a low dose, and then you have to wait a
Right.
couple months, it's gonna work, and increase the dose, like, it's just it's so frustrating. I think one thing I probably wish I would have done differently is, like, done therapy. I had done therapy in the past, um, and I didn't, and I think that probably would have helped a lot, but, you know, maybe next time. Hopefully, it's not as bad this time, but
Right.
but yeah, I mean, it's hard to recognize as, I think the biggest thing, especially postpartum, and I was, I think, lucky in the fact that, like, I had a lot of friends at that point in my life that had young children too. Like,
Mhm.
we had babies within, like, 4 to 6 months of each other, so some of them were stay-at-home moms, some of them were working, like, I was working, eventually, and
Mhm.
but, like, we would be able to meet up and, like, talk and
Mhm.
just be able to, complain or,
Mhm.
we just understood each other. So I was really grateful for that, you know, because I know a lot of people, had babies and, like, none of their friends had babies, and I'm like, "I don't know how you did that." Like, I really don't.
Yeah.
Because having them there, because like, your husband doesn't get it.
No.
Your family doesn't get it, and, like, nobody understands, especially
Yeah.
when they're not like, maybe you can talk to, like, someone who's had kids before, but, like, they're not in it with
Yeah.
you right that moment, and it's just hard, but it's
Yeah.
temporary. It gets better.
Okay. Well,
Now that
yeah.
we're past it.
Right. Well, thank you for sharing. And I know those feelings are so hard to think about. There's moments that I look at my phone, and one, I'm like so thankful I took all the video and pictures that I did because one, you're right. It's like y- for me, it was like a numb out. It was like I can't access all the feelings because I'm too stressed, I'm too anxious, I'm too whatever. So like I'll go back and I'll look at these like pictures or photos and they're beautiful. Thank God I have them. Thank God I took them. But I will literally remember like the overwhelm or like just like that like real tough like exhaustion or whatever, like I will look at those and be like, wow, I felt like so bad. And here's this great photo, here's my baby being so cute, and yes, baby, you are so cute, but in the moment I like couldn't see that. I couldn't see that for you, I couldn't see that for us. Thank goodness I had a snap of a picture, but those feelings are so real.
Yeah, they're very real, and, like, I don't know who says, like, when you have a baby, there's just, like, an instant connection and love because that is just not true.
Right.
It is not, and especially as a first-time mom, like, I don't know, maybe some people feel that way, but, like, it was very hard for me for a long time, but, I mean, obviously, hormones are crazy. I was dealing with, like, whatever health issue I was dealing with, and, like, I don't know, there was just a lot going on, but, like, oh, yeah, it just takes time, and it's like, I think about it now because now I have this 4.5-year-old who literally wants nothing but me and is the
I
cutest thing
know.
ever, and, like, I'm like, "Ha, okay, I get it."
Yeah.
Like, this is it, like, but when they're newborn and, like, it's so hard, you're like, "I don't know what you want," like,
I know.
there's supposed to be this, like, intuition, and I don't know. Oh gosh, it's so hard to figure out, but you do it.
Yeah, you do it. And I think a few things that you're saying and just like I want to like point out is like finding community. So like somebody that's in a similar place than you. And I think that's critical. And then two, you know, seeking help. I think a lot of times, and you're kind of hitting on this, Jess, but like, you live in a world where you're like, I've got this. I've gotten this far in my life with like pure grit, you know, nighttime, whatever, hard moments. Like, I can do this hard moment too. And in reality, yes, of course you can and you will, but you can also seek support in doing that too. And I think that is at least for me, that was like such a big lesson. And that support can look like coming to see somebody like you that can help you with hormones, or going to your OB and like actually getting a prescription, or um, not sacrificing your health because you feel like this is how it has to be when that isn't always the case.
No, it definitely does not have to be that way, and it's yeah, you just have to find the right people, and even just, like, having conversation, calling a friend,
Mhm.
I hope that everyone out there has, like, that one person, that they can call no matter what, whether it's a mom friend or not, when you're struggling because, I mean, yeah, you just need it.
Yeah, for sure. Okay, so Jess, we've talked about so many things. And before I get to like the end,
Yeah.
is there something that I missed where you're like, ooh, we should talk a little bit about this? Either your experience, work, whatever, all the things.
Um, I think so my ectopic pregnancy is kind of
Let's talk about that.
okay. So during this was probably like 2 years ago. I think it was like the first pregnancy I had had since having Caden. Um, I was having fevers, and this is when I was first able to correlate, like, hey, when I get pregnant, like, I get really bad fevers. Like, I didn't realize that I was pregnant, but like I got a fever and it like didn't go away for like, I don't even know, like 3 weeks, and I was like, "Okay, this is not normal." Like, I usually would get fevers and they'd last like a couple days or whatever and whatever. So I found out I was pregnant, and of course, it's what we wanted. We wanted to get pregnant, we weren't really trying by any means at that point, but it was there and we were like, "Okay, great. This is great." And I had contacted my OB. We did the whole like go get your blood work done. Just check the HCG levels. And, I I don't know if my fevers were why, but, I went to go check my HCG levels, and I think, like, the first 2 were okay, but then the 3rd one, like, they weren't doubling like they should have, and, like, I don't know, I was pregnant, and I'm like, "I can't take anything. I can't do anything. I'm not wanna harm this baby," like, so I wasn't taking Tylenol, I wasn't taking anything, but I also had a fever of, like, 104, like, just
Oh my
consistently, and I'm like,
gosh.
I'm probably frying this baby, like, whatever, it's ball of cells in my belly, so
Oh,
we found out that, like, I was gonna miscarry, I hadn't had an ultrasound, I hadn't had anything, and I had just been having this, like, crazy fever for so long, and I was getting fed up, and at this point, my OB had just said, "Just wait it out, you're gonna have a period eventually, we'll check again in, a couple weeks," or whatever, kinda just, like, blew it off, and, this is only the 2nd time, like, 3rd time I guess I had been pregnant, and I'm like, "Oh, okay, I'm just gonna listen to what he says, right?" And I was having such a bad fever for so long, I was so sick of it, and I was like, "You know what?" Like, I had had a lumbar puncture before, and it had, like, the elevated white cells or whatever, and I'm like, "You know what? I'm gonna go to the ER, and I'm gonna demand them to do a lumbar puncture now, like, while I'm having this flare," because when I did it before, it was just a normal day, I wasn't having a fever. I'm like, "Let's go there, maybe it'll show something." And so I go go into the ER, um, demanding a lumbar puncture, and these people are looking at me like I'm crazy.
Mhm.
Um, but I'm like, "You don't understand." Like, and I called, like, the infectious disease guy that I said,
Oh, yeah.
you know, took me under his wing. I'm like, "Look, I'm going to the ER right now. Can you please, like, talk to them and, like, tell them to order whatever it is that you wanna order, but, like, I need to get this done, like, right now because 'cause I'm
Mhm.
having an issue right now." And I was just so sick and fed up. Like, I'm like, "We have to figure this out." Like, obviously, it's not like, I can't get pregnant. I'm gonna, like, miscarry if I get pregnant again, and I was just really fed up. So I went there, ended up getting this lumbar puncture, um, um, by some crazy resident who I don't really know if he knew what he was doing, but whatever. And when I was there, I was like, "Oh, by the way, I'm pregnant. I mean, I'm miscarrying, but I'm pregnant."
Oh my god,
And
Jessica.
and they were like, "Oh, okay," and, like, kind of blew it off and didn't really say anything, and I'm like, "Look, I'm here. I have yet to have an ultrasound." I think my HCG levels were, like, 1,600 or something, like, enough to, like, see something if there was something there, right?
Mhm.
And so, I basically was like, "I want an ultrasound." And, of course, it it was a struggle, but they finally gave it to me. And we went and did it and came back, and I, like, have which I think every single person should have this if they have access to this at whatever hospital or doctor's office they are at, like, an app that, like, whenever you have something done, like, it goes to your phone immediately, like, the
Yeah.
result or, like,
Right.
whatever. And so, the ultrasound results, like, pop up on my phone while I'm sitting here in this emergency room, and, um, of course, I'm medical.
Right.
So,
Right.
I'm like I'm looking at this and I'm reading it, and it's like, "No intrauterine pregnancy found." And I'm like, I pretty
Oh.
sure, like, I'm not 100% sure, but I'm like, having HCG levels as high as they are, like, you should see something
Mhm.
somewhere. Like,
Mhm.
and so I was like, "This doesn't make any sense at all." And, like, I for one, like, nobody mentioned the ultrasound to me while I was in there at all. I ended up staying overnight that night just to well, actually, I don't even know why they had me stay overnight, but I did. And nobody, like, from the moment, like, I left the ER to go up to my room or anything, said anything about the ultrasound. And so, like, I called my OB. Like I said, I have his
Oh
phone
my
number because we
god.
worked together for so long, and I said, "Hey, like, can you please, like, look at the ultrasound from the hospital that I just had because it doesn't seem right." And he calls me, like, immediately, and he's like, "You need to come to" this is, of course, a Friday afternoon. He's like, "You need to come into the office, like, first thing Monday morning." And I was like, "Well, why? Why? Why?"
Right, yeah.
Everything. Like, "What do you mean?" He's like he's like, There's no way that there's not something seen on that ultrasound, like, with your HCG levels being as high as they are." He's like, "I'm concerned that you have an ectopic pregnancy." And I'm like, "Wouldn't the ultrasound person, like,
See that
I
or
don't
be aware of it? Yeah.
like, look around or do something?" No. So, of course, like, he's like, "Well, if you have any pain or, really bad stomach pain or, like, go back to the hospital, but, like, come to my office first thing in the morning or Monday morning." And I was like, "Okay." So, of course, like, I go there and, like, there it is, like, a huge huge ball in my fallopian tube, like a pregnancy, and I'm like, "Ah," I like, was so frustrated, and, like, if I hadn't have gone to the hospital and demanded the ultrasound, Well, for one, I probably would never know. If I wasn't me and, like, understood any sort of medical thing, like, even if I read the ultrasound and been like, "Oh, well, yeah, I guess that's probably fine and normal," but, like, if I didn't understand that and, like, didn't
Yeah.
contact my OB, like, they didn't, alert OB while I was in the hospital to, like, come check it out. Nobody did, and I was like, "That's crazy. The ER should have done that," but they didn't. Um, I would have left that hospital and ended up having an emergency, like, ruptured ectopic a couple weeks later.
Oh
Like,
my God,
coulda
Jessica.
lost my fallopian tube, like, I coulda like, oh, I was so just upset with, like, medicine and
Yeah.
healthcare and just the profession I chose. I'm like, it's just so by the book and, like, rushed and hurried and, like, no consideration for, like, what's actually and sitting in front of you, like, as a provider, and ugh, I was so mad. Luckily, you know, that happened. I talked to my OB. I went there on Monday morning, and I was able to, instead of surgically remove things because it was still so early, like, they gave me a shot of methotrexate,
Mhm, yeah.
and apparently, like, dissolves the pregnancy or whatever, but, like, yeah, like, I think about I think I, like, made a huge post on social media about this and just, like, how much, like how important it is to, like even if you're not medical, especially if you're not medical, like, you have to advocate for yourself, like, if you feel like something's wrong, whether it's with your hormones or whether it's with just your body in general, your baby or whatever, like, you have to advocate for yourself and, like, push for whatever it is you think is going on because 9 times out of 10, like, you're probably right. Like, I had a bunch of issues with my son when he was super young, like, he had chronic diarrhea for the longest time, and, like, nobody would help me. I'm like, "I'm a struggling mom." They're like, "Oh, it's fine, it's fine." And I'm like, he's having so much diarrhea, like, I he's probably iron deficient, like, there's no way he's keeping it in there, and, like, nobody believed me. I finally, like I don't think I could order blood work at this time on my own or anything, but, like, I finally convinced somebody to check it, and, like, he was extremely iron deficient, and, like, I talked to my his pediatrician, and I was like, "Look, like, I think he's iron deficient. Can I please get blood work to, like, check this?" And he's like, "Well, what does his diet look like?" I'm like, "He eats steak." Like, a kid literally eats steak and broccoli and, like, all these iron-containing foods. He's like, "He's fine. He's fine. Don't worry about it. He's fine." And, like, he was absolutely not fine. Like, I just yeah.
Dude.
So, it's just so important to advocate for yourself and just hopefully be able to find somebody in the medical field that you can trust and just, I feel like people just don't take women or moms seriously. It's drives me nuts.
Okay, so a couple things because I think this is just like so huge is advocating for yourself. Why are we here? Why do we have to do this? It's so crazy. It's like you have to like completely educate yourself, then go out, go down the spirals of like the worst case scenario 100 million times. I mean, what is happening?
Well, and of course, like, I was having so much anxiety just postpartum
Uh,
anyways. Like, when I would bring something up, like, the freaking like, the pediatrician would treat me like I was his patient and I needed to go to a therapist or something, and I was like, "I am gonna lose my mind." And, like, I think even my husband, like, didn't believe me for the longest time and until, like, I literally, like, got the proof that, like, he's not okay. Like, it's so ridiculous, and yeah, I mean, I think that's just, like, gender roles or something, I don't know, but women are not taken seriously, and you have to advocate for yourself and your children, your family, or whoever, because no one is helping you. If you really have that gut feeling, just go with it and trust it and do whatever you can to figure it out.
I mean, yeah, I thank you. And thank you for saying that. And you're so right because there are so many times, one, in all of these interviews, it's almost like every single person has this moment of like, they were telling me one thing and I had to literally either like fight or like go in or something crazy to like advocate for yourself. And I just don't know how many times that actually doesn't happen because of something that is missed.
Yeah. And unfortunately in medicine, I know that it happens so much more than people realize. And it's I don't know how to make that I don't know how to make that better or change it, but it's so frustrating. And I just feel, lucky that I know what I know. Like, I don't know everything, but I know some sort of like healthcare medical stuff a little bit,
Right.
to be able to know the difference between when something's not right or it is, but ugh,
Crazy. Crazy. Thank you for sharing about Ectopic. I think that, so I didn't even know that that existed until
either.
I mean, what is this? Like, how do we not know this stuff? It's, and you think about pregnancy in general, and you're right. It's like you try, you get there and you're just like, "Oh, okay, like there should be a baby at the end of this." There's so many wild things that like can happen and do happen, and it's so nuts that is like
Unless you know somebody personally
exactly
that
that happened
dealt
too.
with it.
Mhm.
You have no idea, and like I said, I worked in labor, that was my experience of babies. It's just you get pregnant, you have a baby, and you go home, it's great,
Right.
but it's I don't see I mean, I saw the, pregnancies that didn't go well or the moms that got really sick,
Mhm.
but, the infertility,
Mm.
I don't see any of that because they don't make it to the hospital, and so many people struggle with it, and it's you don't know what you don't know. But yeah,
It's so true.
women's bo women's bodies are crazy miracles, and, they just do crazy things, but I wish more of the medical field had a better understanding of women and just in general when it comes to their hormones and reproduction and all of that stuff.
Thanks for doing what you're doing, Jess. I mean, seriously, this is like incredible work. And I feel like it's all just kind of like starting to like hit the zeitgeist. So, like, thank you. Thank you for like stepping into it, making it happen, doing it yourself. I know that's not an easy thing to do. So, just appreciate your work. Okay, I love it. Can you help people outside of the state of Florida or are you just
So, as of right now, I can do Florida and New York.
Oh, cool.
I'm working on other licenses, but yes, Florida and New York for right now.
Okay, nice. Oh my God, I love it. Amazing. Jess, great. This has been such a good convo. I love it.
No, thank you so much for having me. I'm glad that we were able to do this.
Thanks for listening to It's a Circus podcast. If today's episode made you feel a little less alone, share it with a friend who might need it too. We are building something special at the Turner Brothers Circus, a space for women in transition to find connection, laughter, and support as they navigate motherhood, identity, and taking care of themselves along the way. I'd love for you to be a part of it. Remember, you're doing better than you think. Stay grounded, stay real, and embrace that beautiful mess. And as always, the show must go on. Until next time.